Okay, in this assignment I'm going to be looking at the responses, these being physiological and psychological responses to common sports injuries. These include strains, sprains, broken bones, hematomas, and the healing processes that come after these injuries occur. So first up, we have strains, and strains occur in 3 different stages. And a strain is where a muscle gets put under too much of a pulling force to the point where it can be stretched or torn. So when the muscle is put under tension, there is a chance that it can be strained. The 3 stages of strains are stage 1, being a minor stretch or pull. There'll be no loss of range of movement, and there'll be mild swelling and muscle spasms. However, most of the time you'll be able to continue with what you're doing. This will equal in a less than 10% of disruption of the muscle fibers. Stage 2 is a partial tear of the muscle. You'll lose range of movement. There'll be a high amount of pain, and you will not be able to continue the activity, as you will not be able to exert the same amount of force on the muscle. Stage 3 is a complete rupture. There'll be severe swelling, muscle spasms. The range of movement will be completely lost. You won't be able to move the muscle at all. You won't be able to put any weight on it, and it'll be a 50 to 100% fiber disruption, meaning that the muscle will be completely out of use, almost totally, if not completely. Next up are sprains. Sprains work in the same way. There are 3 stages, and the only difference is sprains occur to the tendons and the ligaments rather than the muscles themselves. So the stages work in the same way. Stage 1 being a stretch or a pull, stage 2 being a partial tear, and stage 3 being a complete rupture. The range of movement loss works in the same way. The pain and swelling work in the same way, and the fiber disruption also work in the same way. Moving on, we've got hematomas. Quite a gruesome photo there. Hematomas involve internal bleeding into or around a muscle, and there are 2 types of hematoma. The first one being an intramuscular hematoma, which is when the blood enters into the muscle that's affected. So for example, if you suffer from a torn bicep, as an example, there'll be a large build-up of pressure as the blood leaks from the broken muscle into the skin around it and the muscle specifically. There'll be significant reduction of strength in the muscle, and the swelling due to the blood being under the skin will be caused. You'll also get quite a significant nasty bruise like the one seen here. There's also intermuscular hematomas, which is where the blood exits the muscle and into the skin around the muscle. They'll be quicker to heal, as the blood can escape the affected area, and thus the pressure is averted. But the area affected, this here is an intermuscular hematoma. If you see the right thighs here, this is the right side, so this is around the hip area. This will be quite quick to heal, as the pressure is averted due to the blood not being centered into one area as it might have been if it were an intramuscular hematoma. Next we have the blood clotting mechanism. This is known as coagulation, which happens straight after an injury to a blood vessel. What essentially happens is the blood will fill the affected area as a liquid. It will then clot to become a solid, which will aid in the healing of a lesion or a wound and will stop the bleeding. So essentially, if the blood were not to clot, it would continue to bleed, and this would cause quite a significant loss of blood in the body. Next up are the stages of healing. These are related to the blood clotting mechanism. The first stage is the hemostasis phase. So this starts at when the injury occurs, and the objective is to stop the bleeding. So in this phase, the body activates its emergency repair system and forms what is essentially a dam to block the drainage of blood from the injury. So the platelets will come into contact with collagen, resulting in activation and aggregation. An enzyme called thrombin is at the center, and it initiates the formation of a fibrin mesh, which strengthens the platelet clumps into a stable clot, and this will block the cut and prevent the bleeding from occurring. The next phase is the defensive or inflammatory phase, and this is where a type of white blood cell enters the wound to destroy the bacteria and remove debris to help prevent infection. These cells often reach their peak population between 24 and 48 hours after the injury occurs, and they will reduce greatly in numbers after 3 days. So as the white blood cells leave, specialized cells arrive to continue clearing the debris. This phase often lasts 4 to 6 days and is often associated with reddening of the skin, heat, and pain. Next up is the third phase. And this phase is essentially when the focus is to fill and cover the wound internally. So there's 3 stages to this phase. The first one is filling the wound. The second is the contraction of the wound margins, as in closing the wound up. And the third one is covering the wound. And that's followed by a very complicated word there that I will not attempt to pronounce. So during the first stage, granulation tissue fills the wound bed with connective tissue. It's essentially like a sand that fills the wound up. And the new blood vessels are formed as a result. During the contraction, the wound margins contract and pull towards the centre of the wound, closing it up. And in the third stage, the wound bed will begin to migrate across and cover the wound with what is like a binding tissue. And this phase can last from anywhere between 4 to 24 days, depending on the severity of the wound. And the fourth and final phase is the maturation phase. And during this phase, the new tissue slowly gains strength and flexibility. Collagen fibers will reorganize and the tissue remodels and matures, and there's an overall increase in tensile strength. However, if you stretch it too far, the wound has a chance of reopening. Depending on the severity of the wound, this phase can last anywhere from 3 weeks to 2 years. 2 years being the most severe of cases. The healing process is broken down into those 4 steps. Next we have the 5 stages of grief. The first one is anger. So after an injury, an athlete can get frustrated in that they feel like the injury could have been prevented. The anger might be directed at themselves or other people, and usually the intensity of the anger will depend on the situation of the injury. So if the athlete is a highly competitive person and as a result of their injury they're missing out on a very important game, they will be a lot more frustrated than someone that is quite laid back and hasn't really missed anything by getting injured. The next is anxiety. So when we get injured, our emotions can be very different and can make us react in quite different ways. So anxiety is the negative effect of stress. So common reactions from people being injured linked to anxiety are panicking or feeling fear. And they might feel fear because they feel like they might be losing out on a lot of opportunities due to their injury. They might feel like they're out of touch with their teammates because of the injury. And this can lead to a lack of motivation, sadness generally. It can also lead to a total abandonment of the sport depending on the severity, or simply just decreased motivation in that sport. Next is depression. Once the severity of the injury is settled in, the athlete may get depressed at the uncertainty of their capability and future. So they might get worried about being dropped by their team. They may also get depressed about missing out on something they've been training for. For example, when David Beckham injured his Achilles tendon and ended up missing the 2010 World Cup, he couldn't travel with the England squad because he was injured. There's also frustration, and frustration is commonly linked with anger. Some people even interchange them, as they're very, very similar. Frustration can occur due to a lack of progress in a rehabilitation program, potential loss of skill, or general deterioration of motor ability. So they can be frustrated in that they can't work to their full potential after the injury. There's also isolation, and obviously an injury prohibits you from training, stops you from playing matches, and this can cause disassociation with your team. And as a result of that, because you can't work towards recovery with your team, the motivation to do so might be lost, and this might make your recovery last longer. Next, we're on to the emotional states of mind. First one's isolation, and isolation can occur very easily if you go from being a big part of the team to not anymore, and this will happen as a result of an injury. People who are isolated might become envious of those who are healthy, because they'll want to be able to continue in the sport even though they know they're incapable of doing so. Envy is quite uncomfortable as an emotion and is often accompanied by shame or guilt. You'll feel guilty about feeling the way you do. And injured athletes usually should know that envy may be part of their experience, especially when the injury is long-term, like a ligament tear. We've also got anxiety. Athletes who fear that they might become re-injured may be more hesitant about performing in their rehabilitation programs, and this can actually hinder their recovery, and it can actually lead to re-injury, as they'll be thinking so much about the injury and trying to avoid it with such drastic measures that they might actually put too much stress on themselves. This can lead in quite a horrible circle to more anxiety, as they may feel like they're never going to overcome the injury, or they're scared of a lack of progress. This links to the next one, fear of re-injury. Injured athletes often have a heightened experience of vulnerability after an injury. They may fear getting injured again, and this can hinder full recovery and the possibility of immersion into sport in the future. There's also depression. When an individual's primary source of enjoyment is removed via injury, it's not surprising that their mood will be affected. So, professional footballer obviously plays football day in, day out. They love the game, they love the sport, and when that's taken away from them, they may find like a big part of their life has simply disappeared, and as a result of this, they may become depressed. Usually, most teams have therapists and counsellors in order to prevent this from occurring. However, some people, they don't find that therapy helps them very much. Counselling doesn't help them, talking to people doesn't help them. Most people try and deal with this in their own way. However, it can be harder for some people than for others. There's also low self-esteem, and this is kind of linked to depression in a way. So if an athlete feels like they're struggling with their rehab and they're not coming back as they planned and doing so, their esteem can take quite a significant dip, and they can feel like they're not good enough anymore. Dependent on the seriousness and the level of commitment from the athlete, this can be more or less severe. Next is the sense of relief. And in some cases, not common cases, but in some cases, athletes can actually feel relieved when they are injured, because it takes the pressure off their shoulders, and they have an unexpected sense of relief and even joy, because they're allowed a moment to themselves and they're not under pressure of performance or critique or anything like that. The relief may be a source of conflict for the athlete though, because they may feel like they shouldn't be able to enjoy being injured, and they may feel guilty for having those feelings, and they might try and hide them, especially from their teammates and their coaches.